Hey everyone, it's Dr. Miller. I'm going to show you, once the bandage comes off, how to put it back on again, okay? So the first thing is there'll be a label, and you want to have the label kind of down and facing forward. So I'm going to be, if you're standing next to the patient, you want to have the two short ones, because there are two long ones. There are two long ones on one side, two long ones on the other side, and a single short one on one side, a single short one on the other. You want to have the short ones up, you want to have the long ones down, and you want to have the label facing away and on the bottom. So you're going to take that and lay that down right over here on the patient. That's it, okay? You don't have to really do anything with the short ones just yet, because it makes it a little bit more difficult. You don't need a lot, maybe just 3 or 4. Yeah, maybe 3 or 4. And then you're going to bend those in half and just put them right behind the ear, okay? Halfway behind the ear and halfway down the neck. Halfway behind the ear, it's all the way behind the ear, but it's halfway up the ear and halfway down into the neck. Two long ones here. Here's the bottom one, the middle one, the short top one over here. And I find the easiest thing to do is just, you're going to take this up and you're going to try to grab these pads on both sides, okay? And then when you do that, you're going to just Velcro it on top. Now, if you notice, I'm keeping my hand here because this may want to slide down. So before I do anything, I'm going to grab this next one and pull it forward, which you can see is where her ear is. And she helped me glide that into her ear. And then I'm going to grab the other one and grab that. And once you connect these two in the front, it more or less just sits nicely, and we have compression of this. That's the most important thing, is this band compressing this. And now we have the two small ones, which can add further compression on the back by connecting over here. I think that's the easiest way. Some people like putting the neck first in, and then this one, and then that one. It's up to you. Come forward and just sort of wrap around the chin so that it might be a little bit more comfortable. Like MicroLift-Face, you can just place this up here as further compression, and on the other side you can press and place this. You saw I did all of that without gloves on, because I find that if you try to do this with gloves, it gets in the way, things get stuck. So wash your hands very, very well, and then you can go ahead and do this maneuver.